Another topic in this slide series is platysmography. Platysmography means the method for recording volume changes of an organ or a body part, for example, a leg or a hand. Kinds of platysmography are strain gauge, based on a strain gauge, chamber platysmography, electrical impedance platysmography, and photo platysmography. As I told you in the previous slide, platysmography in general is a method to record the changes in the volume of an organ. Therefore, we should use methods to measure the change in our organ, and the first method is a strain gauge method based platysmography. A strain gauge in this type of platysmography is made of silicone rubber tubes which are filled with conductive liquid whose impedance change with volume. If the volume inside this ring increases, this tube will be stretched, therefore the resistance will be increased, and we can use to measure the change in the volume. And now we place this rubber tube around the leg, as you can see, and to increase and to save volume change because of each pulse of heartbeat. A venous occlusion cuff is used at this place, a little slightly above the knee, and using this venous occlusion cuff is inflated to 40 to 50 millimeter Hg. In this way, there will be the arterial inflow into the limb, but no venous outflow. But the venous cannot outflow, therefore the volume after this occlusion cuff will be increases for each pulses. We have a curve like this. For each pulses, the volume of the limb under the venous occlusion cuff will be increased for each pulse. And this volume increasing leads to increase the radius of this strain gauge around the leg, and now we can measure the volume changing in this limb. Chamber plethysmography method. As mentioned before, plethysmographs measure change in volume, and the only accurate way to measure change in volume of blood in the extremities non-invasively is to use a chamber plethysmograph. By timing these volume changes, we can measure follow by computing with this simple equation. In this method, a cuff is used to prevent venous blood from leaving the limb, hence the name venous occlusion plethysmography cuff here. As you can see, we a cuff to prevent blood from leaving the limb. And we have a chamber here, a chamber that's something like this. This chamber has a rigid cylindrical outer container and is placed around the leg, and there is a bladder inside this rigid cylindrical container. As the volume of the leg increases, the leg squeezes some kind of bladder and decrease its volume. And also volume transducer can be, for example, water-filled tube or air pressure. This transducer can be used to measure the volume change inside the bladder and the container. You can see a volume transducer here and a volume calibration here. The volume calibration is used to calibrate the bladder's volume or filled of water or air, and a volume transducer here is used to measure the pressure change inside the bladder, and the pressure change will be used to measure the volume change inside the bladder. Okay, let's review the procedure. Like the previous method, strain gauge plethysmography, we use a occlusion cuff, venous occlusion cuff. The arterial can pass to the limb because the pressure of the occlusion cuff is higher than the pressure in venous, but is lower than the pressure inside our arterial vessels. But because the pressure inside the occlusion cuff is higher than the venous, it prevents the blood to leave the limb via venous. And now we have a limb with increasing in its volume. And to measure the volume changing, we use a rigid container, and inside the rigid container we have a a blader, something like a blader, and the limb is inside this blader, and changing the volume inside the limb affect inside this limb here, especially here, affects the volume of the blader, and the changing of the volume of the blader will be detected by this volume transducer here, and the changing in volume will be converted to changing in pressure. In some cases, we can use an arterial occlusion cuff here to prevent the blood leave this region. As I told you before, this cuff number 1, apply a pressure higher than venous but lower than arterial vessels. But cuff 2, the pressure applied by cuff 2 is higher, also arterial and venous, both of arterial and venous vessels. And now we have a limited region here to in order to limit the region of changing. We use these two cuffs, cuff 1 and cuff 2, creates a region to a specific region, a limited a specific region to measure the volume change. And also the arterial and also venous vessels are restricted. From the device perspective, the following points should be noted. Water-filled plethysmographs are temperature controlled to prevent thermal drifts. Because of their hydrostatic pressure, they may constrict the vessels in the limb and cause undesirable physiological changes. Air may be used in the bladder and the resulting change in pressure measured directly. Some systems do not use a bladder. They attempt to seal the ends of the rigid chamber to the limb, but then a leak may be a problem, maybe a big problem. One device uses a pneumotachometer to measure the flow of air into and out of the chamber. This flow is then integrated to yield change in volume. This equipment is designed to accommodate a variety of limbs sizes, so the chambers and bladers are made in a family of size. We should select an appropriate blader size. This slide is about the method, and we can review it fast. A calibration may be marked on the record by injecting into a chamber a known volume of fluid using the volume calibration searing. Here, the venous occlusion cuff is then applied to a limb and pressurized to almost 50 millimeter Hg. which prevent venous blood from leaving the limb. Arterial flow is not hindered by this cuff pressure, and the increase in volume of blood in the limb per unit time is equal to the arterial inflow. If the chamber completely encloses the limb distal to the cuff, the arterial flow into the limb is measured. If the chamber encloses only a segment of a limb, as shown in figure 8.15, an arterial occlusion cuff distal to the chamber must be inflated here, as I told you before, inflated to 180 millimeter Hg to ensure that the changes in chamber volume measure only arterial flow entering the segment of the limb, a restricted, limited segment of the limb, and also early water or air-filled chamber plethysmographs for measuring tumescence have been replaced by less bulky circular metal bands and elastic strain gauges. A few seconds after the cuffs are occluded, the venous pressure exceeds 50 millimeter Hg. Venous return commences and the volume of blood in the limb segment plateaus. When the clinician releases the pressure of the venous occlusion cuff, the volume of blood in the limb segment rapidly returns to normal. This curve, as I told you before, we have an increasing of volume, we have a flat, almost flat region here, and after turn off the occlusion cuffs, the blood, the volume of the blood inside the limb segment rapidly will return to the normal situation, and we have a curve A as a normal with a normal slope of decay. But if a venous thrombosis, for example vein clot, partially blocks the return of venous blood, the volume of blood in the veins return to normal more slowly. Figure B, or slower than Fig B, with lower slope. This technique is a useful non-invasive test for venous thrombosis diagnosis. Therefore, PDAV return is important parameter. And also, at the rising stage here, we can calculate the slope of increasing volume inside the limb segment to find the flow rate. The horizontal axis is time and the vertical axis is volume. Therefore, the changing in the volume divided by the changing of time can be calculated by especially the first seconds of this curve, the rising part of the curve, and you know that dV divided by dt is the flow. Therefore, we can find the flow rate of the blood inside the limb simply by this curve.